Yes, hello. Good day, everyone. My apologies. I still am not feeling well, and earlier this morning I had to nebulize because still cannot breathe. So let us start with our discussion. We have the continuation of our respiratory disorders, and the first one on the list would be your chest and lower respiratory tract disorders. To begin with, we have the first disorder, which is pneumonia. I know this is a very common ailment, and I think you are very much familiar with your pneumonia. Um, if you have had your discussions in pediatric nursing, I mean, even if you have been, I know you were not assigned, right? I mean, in the pediatric ward, this is a very, very common disease, especially when you handle kids who are admitted in the hospital. Um, Parang nagsasawa na nga kami whenever we are assigned in the pediatric ward because the cases that are most likely seen there is actually your pneumonia. We have your pediatric acquired pneumonia, or what they call your PCAP, community acquired pneumonia. That okay, so pneumonia basically it's an infectious process. It is the inflammation of the lung parenchyma secondary to your infection. We have different causative agents for this one, and we have the list are as follows. Yan. Sobrang dami. Sa sobrang dami, hindi mo mabilang-bilang kung gaano kadami yung possibilities for having your pneumonia. I mean, even if you have your streptococcus pneumonia, you can have another case of pneumonia, but with another causative agent. So imagine if you're not too careful about that. Palagi kang papasok sa hospital because of this particular ailment. So that's why it's very important that we have to take care of ourselves. So we have here your streptococcus pneumoniae, which is again one of the more common causative agents for pneumonia. We also have, well, let me draw on this one. There you go. Then you have your Staphylococcus aureus, which is basically, if you can remember your microbiology, most of the diseases associated with your Staphylococcus aureus are your integumentary disorders, such as, like, for example, your acne or pimples. However, it does cause your pneumonia in the general sense of the word, when the Staphylococcus aureus can actually attach itself to your lower respiratory tract. Yes, you can have a pneumonia for that. You have your Klebsiella species, your Pseudomonas, which is, let's um let's try to um, associate this one as one of the more dangerous types of your pneumonia. Marami po kami mga pasyente sa clinical area who has your Pseudomonas and your Klebsiella, wherein the healthcare team had the difficulty in managing the pneumonia to the point that the patient needs to be staying in the hospital for a longer period of time compared to the others. Most of the pediatric patients that we have handled stay in the hospital, especially for pickup, stay in the hospital for like 1 week at least, 2 weeks, 3 weeks. Alam mo yun. And then there are some other patients also who are not too lucky because instead of being on the road to fast recovery, after like a second week of being confined in the hospital from your pediatric ward, napupunta sila sa pediatric ICU because the body cannot tolerate already the severity of the infectious process. So again, wag niyong nilalanglang ang pneumonia. I've known of even adult patients who die because of pneumonia. The more common population who are at risk for having your pneumonia are the very, very young and the very, very old. So these two groups of population have the tendency to not recover fully well compared to those healthy individuals na, well, they have their immune system to back them up. But most of these very young people and very old people are those who are very much at risk for this particular disorder. Okay. Kala mo, laglat lang, sinat lang, ganyan. Pneumonia na pala yun. And yes, there are those who have died because they neglected the manifestations and they also did not went to the hospital for your consultation and for management. Okay, so we have these ones. And E. coli, when we think about your E. coli, we always associate this with your um ano to, yung mga acute gastroenteritis, hindi ba? But yes, there are instances wherein your E. coli might also attach themselves in your lungs, your respiratory tract, and hence cause you to have your pneumonia. Legionella pneumophila, and even your well, hindi mawawala sa listahan ang influenza. Okay? Apart from having your flu, a flu that has not been managed properly might actually result to a rather more serious, okay, type of your disorder or the disease, which could be your pneumonia. Hindi lahat ng pneumonia ay bacteria. Meron tayong mga fungal na pneumonia. Meron tayong mga katulad nito, mga flu, yung mga viral pneumonia. Pinaka-delikado pa dyan are your viral because viruses are self-limiting. And I've mentioned before that no matter how many antibiotics you have, it really won't work at all because unless your virus will decide to get away or get out of your body, you will never be cured of the disease. So what you have with you to combat your virus is to actually have a better immune system so that you can fully recover from the disorder. Okay, so let's move on. We have your para-influenza virus. Well, I've mentioned it already. You have your respiratory syncytial virus, which is not too common here in the Philippines, but in other parts of the world, such as United States. Yes, we also have that one. Rhinoviruses, your common garden colds, can also be one of the reasons why you have your pneumonia, adenovirus, your varicella, rubella, Alam mo itong mga ito, yung mga viruses talaga to eh. A lot of viruses on the list. You also have your pneumocystis jirovecii pneumonia. I'd like you to put a star on this one. This is a very, very common type of pneumonia for patients who are immunocompromised. Examples of patients who have this type of pneumonia na immunocompromised are your HIV patients. Okay? HIV patients who have your pneumonia. Bakit kamo? Because we call this type of causative agents as your opportunistic, opportunistic infections. Why is it opportunistic? Because they target the weaker ones so that they can actually play havoc on the on the lungs or the respiratory system of that weak patient. Kaya kasi opportunista siya eh, para hindi siya mamatay kaagad ng immune system mo, di pipiliin niya yung mga immunocompromised na clients katulad ng HIV or patients who have cancer or patients who have your burns. Anybody who has your compromised situation, your opportunistic infection such as your pneumocystis jirovecii loves that's a particular type of situation. Okay, we also have your Aspergillus fumigatus. I have not come across this type of causative agent in the clinical area. Okay, but this is according to books. Okay, we also have that particular type of etiology. Next one. Okay, ito yung sinasabi ko na one of the very common types of pneumonia in the clinical area, especially for the pediatric type na mga pasyente natin, is that we have what we call your PCAP. Okay, for the pediatric patients, obviously you have your pediatric community-acquired pneumonia. Because obviously, how do we transmit your disorders such as this? The transmission of your pneumonia is usually through droplet infection. Similar when we have your COVID-19. Ganun na ganun. Okay, but with Delta, it's a different thing. It's really more scary than pneumonia. But let's do away with the Delta and let's try to understand the transmission mode of transmission of these types of disorder. Itong pneumonia na ito. If you can remember, yung list natin, there's your bacteria, there's your fungal infection, there's also your viruses, etc., etc. These causative agents transfer themselves from one person to another through droplet infection, and droplet infection can be shared. Let me put you know, can be shared. The blessing can be shared by one person to another by talking, by sneezing, coughing, ano to, uh, blowing of nose, yes. Your usual speaking, yan. Yung mga yan. And if you are very, very close to that patient. Kaya nga sabi natin, for droplet infection precaution, you need to stay away from a person who is considered infectious, at least a meter apart. That was before. But when we had our COVID-19, when we did not understand your transmission-based precaution, your droplet infection precaution, um, yun yung protocol natin sa droplet. But with the COVID, kailangan mo 2 meters apart. Kasi nga, yun yung sabi ng World Health Organization. Actually, we still do not understand much about your COVID-19, but we do understand how mode of transmission for pneumonia is. So, sa community, pwede po siyang even sharing of utensils or glasses for that matter. Yes, it can actually happen. But basically, it's through your droplet. Okay? You have your typical and atypical. Typical is nakikita lahat ng mga manifestations. Atypical, wala masyado. Okay? Except for when it becomes really, really serious. Okay? Healthcare associated is what we call your nosocomial infection. Pag sinabi nating nosocomial, pag sinabi nating healthcare associated, you acquired the pneumonia when you were admitted and confined in the hospital. So imagine the break, imagine the cycle of infection there na hindi na break. 'Di ba? It's very unfortunate for that person to have your hospital acquired pneumonia when in fact the reason why he was in the hospital is to be facilitated and to recover. But because, number one, immunocompromised si pasyente. Number two, hindi nag-ingat si nurse, si doctor, at saka yung mga health allied professionals natin. They did not follow your protocol, hence you have your nosocomial infection. Kawawa si patient, di ba? That is why it's very important for anyone working in the hospital to follow your protocol. Kasi sabi nilang minimum health standards, that's for everyone. But apart from that one, when you are in the hospital, you have to follow your transmission-based precautions. Okay? And this is not just only to protect yourself, but also your patients. Kawawa naman yung pasyente pumasok sa hospital tapos nahawa dahil hindi ka careful. Hindi ba? Next, your pneumonia in the immunocompromised. I have already mentioned that one. And your aspiration pneumonia, as a result of your aspiration, it means to say something has gone into your respiratory tract, causing you to have your inflammatory response, causing you to have your infectious process to actually happen there. Katulad ng mga vomitus natin, di ba? Yung mga patients natin who actually are on NGT, ayan. Tapos, di ba? For our NGT, it is very important that we provide nutrition. Okay, we provide nutrition via your nasogastric tube. Nasogastric tube. Especially for people who are unable to swallow, who are unable to chew their food appropriately through your oral cavity, but because of because you have to follow certain protocols again in order to ensure safety of our client when we are feeding our patient. Yung mga may tubo sa ilong, tapos binibigay mo doon yung pagkain. Now, if you do not follow your safety precautions for these particular patients, like for example, you do not check the patency, of your NGT tube, and ikaw, feed ka lang ng feed ng pasyente mo, not knowing that the tube um, was not actually inserted appropriately or correctly. And instead of the tube going into your stomach, saan siya napunta? Doon sa may lungs mo. Imagine that happening. The food or that osterized food, yung na blended food na dapat diretso sa stomach, saan napunta? Sa lungs mo. That's what we call your aspiration, guys. Something other than air has gone into your lungs. Okay, people actually die from this one. Apart from having your sudden respiratory arrest for that, you might also have your aspiration pneumonia as a result of those food particles, which might not even be very clean. Kasi nga, diretso, pag, kung sa stomach yan, diretso, it's fine because you have your gastric acids to combat your microorganisms, right? But there's none for your lungs. So, nangyari dyan, aspiration pneumonia. Okay? That inflammatory process that's going to be an anticipated reaction of your lungs or of your lung fields. Kasi nga meron kang you have your food particles in your lungs might cause it to have your aspiration pneumonia. We have different patients who actually develop such. But understand this one, your infection develops 72 hours after you have exposure to whatever causative agent there is. Understand? Okay? You don't necessarily immediately have the infection unless there's 72 hours that has gone past, wherein the number of that causative agent has overwhelmed your normal flora, causing you to have, a series of these manifestations. Okay? So that is for your aspiration pneumonia. Okay, speaking of your manifestations, um, what are the signs and symptoms that are very much seen in patients who have your pneumonia? So yes, you have your chills. Di naman nawawala ang chills kasi kasama saan yung rising fever natin. You have 38.5 to 40.5. This one, it's kind of scary. Okay? It's kind of scary, especially for kids, because apart from having your pneumonia, you might also be suffering from your febrile seizures. Okay, and when you have your seizures, what's happening in your brain is that there is uncontrollable firing inside your brain tissues. So it's again kind of scary, especially if you're talking about your kids. For the adult population, we have our own system already in thermoregulation. So we have a better chance at responding on your fever compared to your children. Okay, but nevertheless, it is still a red flag whenever you have your fever, any type of fever at all. Okay, you also have what we call your pleuritic chest pain. It's a type of chest pain which is not relative to your um, cardiovascular problem. Okay, so we are talking about um, the chest pain that is felt by a patient who is actually coughing, who has your chest tightness because yun nga hirap siyang huminga. There is very obvious difficulty of breathing problems. You also have your SOB, your shortness of breath. Pero every time that the client tries to ventilate or tries to inhale or exhale, there is chest pain. Okay. Next, we have your tachypnea as a compensatory mechanism of that DOB that's happening there. Because you would like to have as much oxygen, but well, it's close to impossible because there's a lot of consolidation that's actually found in your lung fields. Okay, maraming laman eh. Puro mga secretions ang laman niyan. Tapos meron pang edema niyan. So, the tachypnea is again an attempt of the body to normalize or actually to get as much oxygen as it can. Okay, so rhonchi and wheezes. Your rhonchi are actually a low pitch. Okay, low pitch sound similar to your coarse crackles, but they happen in the main bronchial openings. As compared to your wheezes are high pitch. Okay, and they actually happen in the finer, mas maliit natin na bronchial airways, your bronchioles. Well, your bronchi is basically for your bronchi, okay, even your trachea for that matter. Okay, and then we have your rhesus are heard either usually ang associate natin exhalation, di ba? Pero actually no. There are instances where in the wheezes are actually heard even if a person is actually inhaling. Okay, so para siyang alam niyo yung mga asthmatic patients natin, yung naririnig yung pag humihinga sila, ganyan na ganyan yung wheezes natin. Okay, use of accessory muscles of breathing. I have mentioned this one before. Mental status changes, one of the earliest signs of your manifestations for anything that involves your decrease in your oxygenation. Okay, and then sputum production as a result of that inflammatory reaction caused by your um, specific causative agent. So I've already mentioned the different types or the different colors and textures of your sputum. Okay, so these are your manifestations. How do you even diagnose your pneumonia? Basically, the doctor relies on your chest X-ray, but the confirmatory laboratory diagnostic examination for any type of pneumonia will always be your sputum test. Okay, because you would like to find out yung you would like to find out the causative agent before you are able to start on any type of antibiotic or medication therapy for your patient. Okay, but your chest X-ray provides you a coverage of an parang extensive visualization hanggang saan yung apektado sa lungs ng isang pasyente who has your pneumonia. So with your chest X-ray, what you can see there is your lobar or segmental consolidation dito. And then you have your pulmonary infiltrates and even your pleural effusion. Sometimes there's just a lot of water. Well, the fluids that have built up there might be characterized by your mucus production and at the same time by the inflammatory reaction that's happening in your bronchial openings or bronchial airways. Okay? I have mentioned your sputum culture. You have your gram staining there as well. And hindi po mawawala kapag meron tayong infection, you will always have your elevated WBC count. And you also have your ESR. What is your ESR? It's your erythrocyte sedimentation rate. It does not confirm infectious process, but it does confirm you, in general, your inflammatory response. Okay, and since there is infection, your inflammation also happens, and therefore, you also have your elevated ESR. Okay, so those are your diagnostic examinations for patients who have your pneumonia. How are we going to treat your pneumonia? Medical management are as follows. Pinaka-common kasi is your antibiotic. Why? Because, again, pinaka-common na causative agent for your pneumonia are your bacterial pneumonia. Okay, hence you have here your antibiotics in the form of your fluoroquinolones or even your cefuroximes or your cephalosporins. Ayan, no? Ito sinasabi ko example, lahat ng merong letter C, E, F. Ayan. Okay? Lahat ng merong letter C, E, F, those are your medications na cephalosporin and they are actually used for patients who have your pneumonia. Marami kaming pasyente doon sa pediatric ward talaga, pediatric ward. You have your cefuroxime. We also have your fluoroquinolones, mga lahat na may floxacin. Fluoroquinolones, ayun o, flo. Fluoroquinolones, flo. Okay, respiratory fluoroquinolones. Medyo mahal tong gamot na ito, sa totoo lang. And usually these antibiotics are given at Q6. Okay, Q6 for our patients. Next we have, ngayon, what are we going to do if we do not, if the causative agent are viral infectious processes? So kapag ganun, huwag mong bigyan ng antibiotic kasi iba ang kinakalaban ng antibiotic. It's not your virus. Okay, so when you have your viral pneumonia, the least or the best thing that we can do for our patient is to support, okay, provide your palliative care. Palliative care, do not associate palliative care as for the dying only, okay? Palliative is that it's type of management that you provide to your patient based on his signs and symptoms. So, if the patient is suffering from dehydration, you provide your hydration. You provide your fluids, IV fluids to your patient. If the patient is suffering from your fever, you provide your antipyretics such as acetaminophen. You also have your paracetamol. Next, antitussive medications such as your Robitussin or your guaifenesin. Yes, antitussive. Ano ibig sabihin yan? Bawal po tayong kasi tussive is cough. So, antitussive, it's anti-cough. So, you provide para hindi masyadong mahirapan si patient. Patients who have their pneumonia will always have your coughing reflex. And it's going to be as very, very frequent. And nakakapagod po yun. Ubo ka ng ubo. Kapagod ka. Sobrang, it's going to drain you of all of your energy. So you are provided your antitussive medications. And we also have your antihistamines because there are instances wherein um, your pneumonia is aggravated by your hypersensitivity reaction. Okay, dahil sa allergies mo. So, you provide your antihistamine medications as well. And finally, we also have your nasal decongestants. Kasi, hindi lang po ubo ang pinag-uusapan natin dito, pati sipon. Kasi nga, ano yan siya, kambal yan silang dalawang yan eh. Cough and colds always go together. Okay? So, you have there. Dextromethorphan is also your antitussive medications. Okay? Next, we have medical management. Whether this is a bacterial type of pneumonia or whether it is a viral type of pneumonia, your bed rest talaga, it does you a lot of things. That's why if you do not feel well, you need to really, really, really rest. Okay? And then, apart from that one, there's only um, so much that your bed rest can actually do for you, but it's only for a certain extent. Pero paano naman kapag your lungs aren't actually working properly? So you lose a lot of your oxygenation. So what you need to do is to have your oxygen therapy. Now, I hope in your skills laboratory, your oxygen therapy is actually discussed because we have very different ways on how we can deliver your oxygen to your patient. And many of these modes or methods are very, very much dependent on how well the patient is able to respond to the therapy. Sometimes we might be giving the nasal cannula, tapos hindi pala effective. So, magpuproceed tayo sa susunod na type of your administration of oxygen. Okay, so I hope you please read on that one and please listen to the discussions of your RL instructor. Okay, that is your oxygen therapy. So we have here, this is your face mask. Okay, medical management. As I've mentioned earlier, in cases wherein oxygenation is a huge problem already for a patient who has your pneumonia, ito na yung i-expectin mo. Kung ang pasyente mo, even meron namang bed rest and then your medications have already been given, but still, the patient stats are actually going down. Oxygenation, I mean your O2 saturation is like, what, 70, 65s, ganun. Considering that the normal is 95 and above. Okay? That's, again, a red flag. Ready ka dapat, magre-ready ka. Kasi you will have to provide your respiratory support. Something that the client needs very much. Ano ang wala? It's your oxygen. So we provide these respiratory support. As you can see in this picture here, you have your AT tube. Okay? I'm sorry. You have here your AT tube. And this one here is what you call your laryngoscope. In the vernacular, ito yung sinasabi natin na tinutubo. Why? Because your face mask, your nasal cannula, your BiPAP, they aren't working anymore. Those are your non-invasive oxygen delivery modes. Okay? Kasi 'di ba? Again, I would like to repeat, what is missing from your patient? It's your oxygenation. and your normal ventilation patterns can actually not be working anymore. It's not working for your patient anymore. And even if you have your oxygen delivery, it's still not working anymore. Hence, you have your respiratory support. You need to have high FiO2. FiO2 means your fraction of inspired oxygen. It's the percentage of O2 that is being delivered to your tissues. Okay? It's very, very important that you must have your high FiO2 if your problem is oxygenation. How can you deliver that one? Well, um, you have your partial rebreather mask, you also have your non-rebreather mask. Yung